Are you looking for a different type of healthcare? Innovative Health and Longevity provides an integrative functional approach to healthcare. This reflects my approach and is the product of my training, ongoing education, and 25 years of experience in clinical practice. Functional medicine identifies and addresses the root causes of disease in a holistic manner. It goes far beyond the symptom management. Integrative medicine combines techniques from different healing approaches and makes use of the most effective and least risky therapies. My name is Dr. Qadir, and I am a board-certified head and neck surgeon, and I'm also certified in functional medicine. I practiced ENT surgery for over 20 years, but started learning and incorporating functional and integrative medicine techniques to address my patients' chronic health problems due to the gaps that I kept seeing in conventional and medical surgical approaches. I've retired my scalpel and most of my prescription pads, and now I exclusively practice integrative functional medicine. My team and I are trained in nutrition, lifestyle medicine, and natural therapies. But we also know when medications or surgery are required, and we do not hesitate to rely on those when they're warranted by a patient's condition. Consider this. If you had a rock in your shoe that hurt your foot every time you took a step, what would you do? Would you just take an aspirin to relieve the pain? Or would you address the underlying problem and shake the rock out of your shoe? You'd shake the rock out of your shoe, of course. And that's a great metaphor for the functional medicine approach. Address the underlying cause. Instead of just prescribing a medication to lower your blood sugar, the functional medicine approach helps you to reverse your type 2 diabetes by addressing the underlying causes and optimizing lifestyle factors that caused it in the first place. At Innovative Health, we're passionate about helping you regain your health and vitality. We help you to take charge of your health, and we're going to start that process right now with you. By educating you on America's healthcare crisis and helping you understand how the system is failing patients, we will discuss some of the underlying reasons why you're not feeling your very best. At the end, we'll give you a fantastic opportunity to come in for a one-on-one consultation at our clinic to begin your journey to optimal health. We work with you as a partner to identify and address the underlying causes of your health problems and help you to reach your health goals. The functional medicine approach has changed numerous people's lives and is being sought after by people who want to optimize their health and resolve chronic disease, not just manage it. Is there a place for conventional medicine and pharmaceutical drugs? Of course there is. Patients with acute injuries, like a fractured arm, are best treated at emergency departments or in surgical settings, if necessary. An antibiotic can be life-saving in the face of a severe infection. This type of medicine is what the conventional system excels at: emergent crisis care. However, research has repeatedly shown that conventional medicine is not good at helping patients who suffer from chronic and degenerative diseases. This is where integrative functional medicine has been proven to be a much better approach. Americans spend over $3.6 trillion a year on healthcare. According to the Center for Disease Control, chronic diseases that are avoidable through prevention account for 75% of the total cost. This includes diabetes, heart disease, high blood pressure, and many forms of cancer. Unfortunately, very little is invested in preventing disease. In fact, 97 cents of every medical dollar goes to treat diseases after they have already occurred. Only 3 cents is spent on preventing disease. Imagine illness as an overflowing sink with water spilling onto the floor. Conventional healthcare would treat this condition by continuously mopping the floor, inventing better and faster mopping techniques, never thinking to figure out where the water was coming from. Medical training programs do not train doctors to think beyond the symptom and reach up and turn off the faucet, the root cause of the problem. In conventional medicine, when blood pressure increases, a patient is given high blood pressure medicine. When cholesterol increases, they're given a statin drug. If you have problems sleeping, your doctor is likely to simply give you a pill to help you with sleep and not investigate any further as to why you're having these problems. In the U.S., we spend more than $400 billion a year on prescription drugs, more than any other country. And while some of these drugs can be life-saving, many come with serious side effects. And what does conventional medicine do for you when you're suffering side effects from a statin or a sleeping pill? You guessed it, they prescribe you another drug. In fact, senior citizens fill between 9 and 13 prescriptions a year, taking an average of 5 to 7 drugs at a time. We throw money and prescriptions at health problems. It's not making us any healthier. The U.S. has the most expensive healthcare system in the world. Yet, our health outcomes rank 50th among all other countries in the world. Medical errors are the third leading cause of death, and that includes prescription errors and medication side effects. Conventional medicine providers typically see their patients in 15-minute blocks, sometimes double booked, because they're paid both by their employers and insurance companies by the number of patient visits, not by the quality of those visits or health outcomes. They have one eye on you and one eye on the clock. The system rewards doctors who see patients quickly and efficiently. I want to make it clear that I'm not bashing these physicians. They're in general very passionate and care deeply about their patients. But they're forced to work in a system that emphasizes efficiency and high volume of patient visits instead of improving patient health. Your health insurance card does not actually insure health. Health insurance merely reimburses providers who work in the system I just described. But it often does not cover lab tests and treatments that can diagnose and resolve a problem before chronic disease takes hold. It doesn't pay for a wellness education for patients on how to optimize their health, prevent disease, and use lifestyle changes to manage their own conditions. It doesn't help to pay for healthy, wholesome foods. It usually doesn't pay for a gym membership. Just as life insurance doesn't insure life, health insurance does not insure health. Your health insurance pays for a disease management system once disease has already occurred. It's probably obvious to you now why you've been struggling to get results in the conventional healthcare system. We're going to move on now to describe our approach to health and how we help our patients to get such incredible results. You're watching this introduction to our practice because you're looking for a solution to your health problems. And perhaps you've already tried to fix things on your own. At Innovative Health, we customize a wellness program for you to not only uncover the underlying cause of your health issues, but also to empower you to take charge of your health and reach your health goals. We spend a lot of time really getting to know you and evaluate and support each of the 5 fundamental pillars of health: nutrition, fitness, detoxification, hormone balance, and neuroemotional factors. We recognize that there is a physical, emotional, and spiritual side to each individual, and we help you to learn to nurture each special aspect of yourself. We will teach you how to use mental techniques such as meditation, affirmations, and visualizations to transform your life. We treat the whole person. Once we have developed a plan to help you to optimize your pillars of good health, we may recommend 1 or more integrative therapies to help your body recover from the chronic conditions that have started to affect your quality of life. We use natural substances such as vitamins, minerals, amino acids, and herbals therapeutically because they can be even more effective than medications and are far safer. If medication is required, we don't hesitate to recommend it. When necessary, we also use highly effective and integrative approaches as part of an overall plan for recovery and wellness. Please visit our website to learn more about these therapies. One of the most common phone calls we get at our clinic is from new patients who say, "I feel really terrible, but my doctor ran my blood work and said I'm normal. So I'm looking for someone who can truly help me understand what's happening in my body." Being told you're normal when you feel terrible is so frustrating. But here's why it happens. First of all, it's important to know exactly what tests were performed. Conventional medical providers are trained to run a very limited list of tests, and the tests that would have provided answers has often not been done. Also, when results are reported, the lab provides a normal range. Unfortunately, normal ranges are generally very broad and based on tests done on everyone and not just on healthy people. At IHL, we perform comprehensive testing that allows us to determine the root causes of your health problems and interpret these tests by taking into consideration the optimal ranges, not just the normal ranges. This allows us to develop a wellness plan that will serve as the roadmap for your recovery. The standard list of tests done annually by family doctors is only about 5% of the testing that we perform on our patients. At Integrative Health, we look beyond the official medical diagnosis. We're also concerned with why you have that problem and what caused you to develop it in the first place. We identify the underlying causes of disease and develop a plan to help you truly optimize your health. We do not simply find a drug to match your diagnosis. Your need for medication decreases as your health improves. Let's discuss the process of becoming a patient at Integrative Health. We can work together through telemedicine or in person. The first step will be to schedule a brief, free introductory phone call. In this call, we will discuss what you're going through, how you've tried to address your health concerns in the past, and how we may be able to help. We want to make sure that we're a good fit for what you need, and that you're a good fit for our approach. If you feel that we're a good fit to work together to help you resolve your health concerns, and we feel that we can help you, we will schedule a 1-hour consultation that will allow us to outline and discuss a comprehensive plan to help you to optimize your health. The purpose of this appointment is for us to get to know you and for you to get to know us. We want to learn more about what you're going through what your health goals are, and begin to uncover what other providers have missed in the past. We will begin to develop a program of care that finds the root causes of your health issues and enables you to reach your health goals. Please call the office to schedule your appointment and ask any additional questions. I request that you come on time and complete your paperwork in advance. This ensures that you get most out of our time together. Additionally, for your wellness evaluation, I ask that you bring your spouse or significant other to the appointment or have them available with you if this is a telemedicine appointment, even if they aren't being seen as a potential patient. There's so much information sharing and decision making in that first appointment that it's important to have your partner present, as it's really hard to go back later and relay all that information to them. So I ask that you not only bring them to the consultation, but also have them watch this presentation beforehand so we can dive right into discussing your case and specifics in that appointment. Now, I would like to answer some common questions I'm asked. The first is, do you take insurance? We do not accept insurance for our services. The main reason for that is that insurance does not cover the kind of health restoring services we provide. This freedom from the restrictions of insurance enables us to find and use the latest and effective treatments for a wide range of conditions. Is this affordable? Absolutely. We work with many different types of people, from retirees to single parents. If this is a good fit for you and you are ready to do what is necessary to regain your health, we will try our best to help find a way to make it work for your budget. Is the diet or exercise requirement difficult to complete? Absolutely not. We believe in teaching people sustainable habits that they can practice their entire life. Everything we recommend is grounded in the latest science. We do not ask our patients to do anything that we are not doing or have not done. Do you have to be local? We're located in Uniontown, Ohio, between Akron and Canton, but we work with people long distance all the time, which means that we can not only help your relative who lives out of state, but also that we can talk with you over the phone or video if you can't always make it into our office for appointments. Last but not least, I urge you to stop procrastinating and come in for this initial consultation. Most people spend months, if not years, pondering major life choices before taking action. What is lost in the wasted time is a more vibrant, healthy life. I cannot wait to meet with you and guide you along the path to wellness. Call today to schedule your consultation and start your journey back to good health. Thank you for watching.